in Rachel Reeves's speech, it was quite interesting. One, we've already seen what happened when a heckler got up and was dragged out, talking about free Palestine and stopping oil and all the rest of it. Also, just as she was in the midst of admitting that she was very, very happy with her relationship with the public sector unions in particular, says she was proud to have given pay rises to them. Just about at the same moment, 1 minute later, while she was still speaking, the nurses rejected a 5.5% pay award, which looked a bit like a snub to the new Labour Chancellor. Let's talk to Anthony Johnson, campaign organiser for Nurses United and also an NHS nurse himself. Anthony, very good morning to you.
Hi, thanks for having me on, Mike.
Not at all. I mean, this was a fairly killer-timed sort of announcement, wasn't it, yesterday, from the Nurses' Union? I mean, I think a lot of people out there perhaps weren't aware that there was a 5.5% pay offer out there. Why do you think the nurses decided to announce it during Rachel Reeves's speech?
Well, I think that we can all see how unsafe our NHS is at the moment, and I would assume that we'd already planned to have the vote on it because it'd been going on for quite a long time where the pay award had been offered. And so it had just happened to coincide with Labour's speech. But the reality is we can all see how unsafe our NHS is. That's the reason why we voted to reject it yesterday, because we want to have things change.
Is this a 5.5% pay offer that came from Wes Streeting when Labour got in then?
Not that I'm aware. I mean, the independent pay review body offered 5.5%, and it seems like Wes Streeting was happy to go along with that. Right. But the reality is the average nurse's salary has still fallen by a fifth since the recession back in 2008. So we've seen waiting lists go up during that time. We've seen staffing vacancies increase. The NHS is unsafe, and that's the reason why we voted to reject. OK, so this is not the 5% that was accepted by the Royal College of Nursing back in the day, back end of last year, I guess, when the Tories were still in? No, it's not. This is on top of that? Well, every year they go do a pay award.
Right. I get that. I'm just trying as a point of information to work out. So you had a 5% pay rise, which you accepted last year, but this year you're not accepting it.
But I'm pretty sure it wasn't 5% last year.
It was.
They talked about having an unconsolidated.
They asked for 18. No, they asked for 18%. That was where it started, and then it got whittled down to sort of 10 or 11, and eventually it was 5.
Yeah, but it was an unconsolidated increase, and as I've said, inflation's grown so drastically, we've lost pay.
I'm not arguing. I'm not arguing with you about that. I'm just trying to make sure that we know what the facts are. The facts are that you accepted a 5% pay rise last year. Since then, inflation's actually gone back down, and you're not accepting 5% this year.
Yeah.
Right. That's the situation. Listen, you're perfectly entitled to do it. It's your job to rally on behalf of nurses. But what is the nursing fraternity then prepared to accept? What are they asking for?
I mean, I think that similar to what's happened with our medical colleagues at the moment, we want to have our pay restored back to where it was with safe levels. So if we've lost a fifth of our pay since 2010, it might take some time, and I appreciate that it's going to take some time to be able to get back to that. But we want to see some positive efforts to bring our pay back to where it needs to be. Given us a 2% above inflation rise, when our pay's fallen so drastically and vacancies have increased during that time, it's not acceptable. And I don't know why anyone, including this government, whoever it is, would want to be arguing for things to be less safe within our NHS when we can all see what's happening.
Well, they gave 22% to junior doctors. Do you think you want to get something closer to that figure?
Well, I think that it'd be nice if they gave us some kind of parity, because at the end of the day, we all can see that it's not just doctors that run our NHS, and when we're waiting for investigations, it's not just nurses either. We need to have more people pulled back into the service so that they're actually doing jobs, help get us off these incredible waiting lists. And it's not going to be solved by just going and offering a pay rise to doctors, but not to other professionals.
That's true, but Wes Streeting's already said he's not giving any more money to the NHS. That was one of his first statements, after giving the 22% to doctors. So he's going to have to go back on his word, heaven forbid.
I mean, the thing is that we're wasting money all the time on agency spending. We're wasting money on people getting iller. Like, there is a net investment that comes from increasing staff's pay. You know, we get to be more productive at work. We get to have more staff within the sector. We do more work, and we help get people better so that they're not getting iller sooner, which costs a heck of a lot more money than it would to just allow ourselves to be what is essentially a national sickness service. We want to be proactive in stopping people getting unwell in the first place.
Well, the problem you're going to have this winter as well is that pensioners are going to be coming into hospitals and doctors' surgeries because they're going to be iller as a result of the winter fuel allowance being taken off them.
Yeah, I mean, yeah, I'm obviously not going to be supporting getting rid of pensioners' winter fuel allowance.
No, I mean, that is the problem for Labour, isn't it? I mean, they've come in as a Labour government, but they've already upset the nurses' union. They've already upset lots of their own backbench MPs who are not happy about this winter fuel benefit being taken away. Rachel Reeves said yesterday that she's standing by it. She's sticking with it. She had an opportunity, if she wanted to reverse it and say, do you know what, we can do it next year and just give people a bit of a breathing space. But she hasn't done that. I think that's very un-Labour-like, don't you?
Yeah, of course I do. I mean, Lord Darcy's put this report about the NHS, about how we need to be concentrating more on public health. Winter fuel payments are a part of that. You know, you need to be going and investing in small measures like that, keep people safe. They stop people getting unwell. They stop them ending up in A&E. So, yeah, I do think it's really stupid to symbolically cut pensioners' winter fuel payments, to be honest.
Do you think over the course of the next few months we might see another nurses' strike then?
Yeah, I mean, unfortunately, if we're not going to be able to see any change in terms of the way that the government's going to approach this issue, and they're all talking about change, they're all talking about things getting better, then I would anticipate that happening. I got into nursing to make a difference to my patients' lives. I don't like going into work every day, as I'm about to do soon, having a situation where we're constantly struggling to be able to give the care that we want to give. I want things to improve and get better. And I hope the government listens to us on this. You
don't need to tell me where you work, Anthony, but what's it like where you work? When you go in today, what will you be doing and what will be your main frustrations?
I'll be apologising to people that their operations haven't been done sooner. That's unfortunately what my role ends up involving a lot of the time, is taking a lot of the flak because things are so slow. And as I said, unfortunately, it's not even myself, it's not necessarily doctors that could speed that up. It'd be about whether or not we can get your chest x-ray done, an echocardiogram done. These are investigations that require skilled staff from radiology departments. Those guys need a pay rise too. And so that's the reason why it can't just be offered to one subset of the health workforce. We all need to have our pay brought back to where we need it to be for us to keep staff in post, for us to be able to help people.
Would you say the NHS is badly run, though, by the NHS? Because there's an awful lot of managers. People tell me if you're in a hospital, you've got at least 7 or 8 managers above you. You can't do anything unless you get everything signed off. You know, it seems to me to be a pretty inefficient way to run a business.
I mean, I think that the problem is that if you're going to end up having a situation where you're even now cutting staffing vacancies within the NHS because you're struggling to get by, part of it potentially could be down to management decisions, but they're operating in the environment they're in. You know, if you're not going to give the NHS enough money to be able to do its job...
But they've got more money than they've ever had, though. That's not, you can't make the money argument, Anthony, because they've got more money than ever. It's just that they're wasting so much of it, as you've said, on things which they shouldn't be wasting it on.
Yeah, but the reality is it's not kept up with the cost of inflation either. So they've got more money. It's not, because if you look at the way that the ageing population is going to impact
you've just told me they keep wasting money on agency nurses, right? Imagine if they didn't do that. Imagine if they had proper paid nurses on a proper staff level who didn't get paid 3 times what these people make. Then you'd have a lot more money.
But that's not.
That's nothing to do with the government. That's to do with the management of the system, isn't it?
No, Mike, it's not, though, because they're not the ones setting the pay for staff. That's a national decision. Unfortunately, that's a government decision of where staff pay is.
It's NHS England that make those decisions.
It's not. It's the independent pay review body makes a recommendation, and the Secretary of State of Health and Social Care decides whether or not to go along with it. Or they could say, "No, scrap that. I'll give nurses and all other healthcare professionals a pay rise."
But the agency rates are set by the agencies, aren't they?
Yeah. So
they're not set by the NHS.
But what I'm saying to you is that if national pay is so low, you're going to have drivers then for people to leave the service to work in agencies. If a national decision was made to increase staff's pay, people are not going to say, "Oh, I'm going to give up the security of having my role, not having to go constantly do agency shifts where I don't know where I'm going to be working every day." They'll obviously opt to go work back in the NHS, but they're not going to do it if they can't afford to live. And that's the reality for a lot of agency staff.
But a lot of agency staff do it because they want to do it. A lot of nurses don't do it because they don't want to do it. So it's not a necessity. It's just for people who want to make more money, isn't it?
Yeah, but I'm one saying they want to make more money because their pay's fallen.
Yeah, but
That's
you
the thing
don't
I'm
do it,
saying.
do you?
No, I don't do it.
So
but
you don't. So you don't get paid more than everybody else. So you make a moral choice not to screw the NHS out of more money.
Yeah, but what I'm saying is that those agency staff, when you talk to them, they say that if pay was better, if they weren't working in conditions where they're constantly understaffed, they say they wouldn't have gone and opted to do agency.
But they're working
That's
in
what
the
I'm trying
same.
to say.
But they're working in the same conditions, understaffed, but they're getting paid more, so that's okay.
Unfortunately, though, it's not the same, though, is it? Like, I mean, if something goes wrong at work and I'll have to stay, because obviously I'm going to be back there tomorrow.
Yeah.
Unfortunately, we know that that's not going to be the issue for agency staff. It does give you the opportunity to pick up and leave.
I get all that, but I think it's a very complex and multifaceted argument is all I'm saying. It's not just about we need more money. I think that's the point I'm trying to make. Anthony, good to talk to you. Thanks very much indeed. Have a good day at work. Campaign organiser for Nurses United. I think it's time we started to look at why people want to make more money. There's nothing wrong with making more money, but if the NHS was better run, whether or not they paid more money out, it would be a much more efficient organisation.